Hello guys, welcome to my YouTube channel Legend Pharmacy. So today let's discuss about the part 2, that is multiple choice questions of pharmacology, general pharmacology. We come across the 11 question. Today let's complete 30 questions. Which of the following antiplatelet is a pro-drug? See, one important trick in GPAT is you have to read the question twice. Which of the following antiplatelet drugs is a pro-drug? Here see clopidogrel. Yes, right answer. Clopidogrel, it is the pro-drug. Then tirofiban, no. Aspirin, no. Dipyridamole, it is also not a pro-drug, but clopidogrel, it is a pro-drug. Next 12th question, highly ionized drug. Okay, see, is excreted mainly by the kidney. A highly ionized drug is excreted mainly by the kidney, can cross the placental barrier easily, is well absorbed from the intestine, accumulates in the cellular lipids. Which of the following is correct here? A highly ionized drug, it is excreted mainly by the kidney. It is right answer, A. Can cross the placental barrier easily, means blood brain barrier. See, ionized drug will not pass the blood brain barrier. Clear? Unionized drugs will pass the blood brain barrier. And is well absorbed from the intestine. No, ionized drugs are not absorbed, unionized drugs are absorbed. Accumulates in the cellular lipids. No, unionized drug get accumulates. Next 13 question. The extent to which ionization of a drug takes place is depend upon pK of the drug and pH of the solution in which the drug is dissolved. Which of the following statements is not correct? So option A, pK of a drug is the pH at which the drug is 50% ionized. Yes. Small changes of pH near the pKa of a weak acidic drug will not affect its degree of ionization. It is also a right statement. Here they ask not correct, means false statement. Third option C. Knowledge of pK of a drug is useful in predicting the behavior of various body fluids. It is also right. Option D. Phenobarbital with pK of 7.2 is largely unionized at acidic pH and will about 40% non-ionized in the plasma. It is wrong statement. Actually, phenobarbital with the pK of 7.2 is largely unionized at acidic pH. No. See, phenobarbital with pK of 7.2 largely unionized at acidic pH. Yes, phenobarbital it gets more unionized, means it having good absorption capacity in acidic medium, but not the pK of 7.2. The pK of about 4.2, 3.1 this way. So option D is the right answer. Next you go for 11th one. All of the following statements regarding bioavailability of a drug are true except 4 options, 3 are true, 1 is false. Which of these? It is a fraction of administered drug that reaches the systemic circulation in unchanged form. Yes, it is right option. Means it is correct. Correct means for the 14th it's not an answer, it is correct statement. Yes, you know that what is the definition of the bioavailability? The amount of drug reaches to the systemic circulation in unionized, means in unchanged form. Clear? Then second one, B option. Bioavailability of an orally administered drug can be calculating comparing the area under curve after oral and intravenous administration. Yes, right. Low oral availability always. Low oral availability always and necessarily means poor absorption. No, it is wrong statement. See, oral availability always, no, always it's not having the poor absorption. See, some of the sublingual drugs, it is a oral absorption, there is having good bioavailability. Yes, C option is the right answer. D, bioavailability can be determined from plasma concentration of or urinary excretion data. It is also wrong right statement, but answer here is a C. Which of the following drugs should be removed by dialysis? Yes, very important one. C, salicylates is the answer. Digoxin, it cannot be removed by the dialysis because it forms the plasma protein. means it's bind with the plasma protein. Digoxin also, benzodiazepine also, organophosphate also. But salicylates like paracetamol, aspirin, they will not bond to the plasma protein, so they can be easily removed by the dialysis. They are free in nature. 16th one, which of the following is true? As the concentration of the drug increases over the therapeutic range, only the bond form of the drug increases. Next option we will read. The bond form is not only available for metabolism but is available for excretion. Bond form is not only available for metabolism but is available for excretion. This is a wrong statement. Actually, the bond form is there, no? Yes, obviously it is not available for metabolism, but it is also not available for excretion. No excretion. Excretion, who will excrete from the body? Only the drug which are free in nature. These are not bonded, they can get excreted. C option, acid drugs bind to beta globulin and basic drugs bind to albumin. It is also right. Albumin to basic drugs to albumin, acidic drugs to beta globulin. Sorry, it is wrong statement. Which they have asked true statement. Which of the following is a true? True statement they have asked. Clear? Here the bond form is not available for metabolism. Which of the following is a true statement they have asked? Binding sites are non-specific and one drug, yes, see. Sorry, they have asked which of the following is true here. See, acidic drugs bind to albumin and basic drugs bind to beta globulin. So it is, according to this, it is also correct option. B also not correct option. A also not correct option, but option D is right, because binding sites, they are non-specific and one drug can displace the other. Yes, obviously right. Then 17 one. In a patient with nephrotic syndrome and hypoalbuminemia, protein binding at which drug will not be affected? Morphine is the answer for this. Next, drug transport mechanism include option 18th one. See here, active and passive transport, both answer A and B. Both active and passive helps for the drug transport mechanism. Duration of action of intravenous administered drug depends on protein binding, yes. Clearance, yes. Distribution value, lipid solubility, half-life. All options are right for 19. Clear? Understanding what I am telling? Yes. Causes for reduced bioavailability. Which among these, which is caused to reduce the bioavailability? High first pass metabolism. Means bioavailability means to reach the systemic circulation. If there is a high breakdown of drugs, means then the drug can't move to the systemic circulation. So high first pass metabolism, it is one cause. Then increased absorption, is this cause? Increased absorption, it reduce the bioavailability? No, increased absorption, it will increase the bioavailability. Cause, it's not a cause. IV drug administration, no, it is not. IV drug, intravenous drug will increase the bioavailability. This is the cause to increase the bioavailability. High lipid solubility, yes, it is also it will increase the bioavailability, but it not decreases. Non-ionization, it is also increase. Here option is A, high first pass metabolism. Cytochrome 3A4 enzyme are affected by option cytochrome 3A4 enzyme, they are affected by the option B and C, that is phenytoin and carbazimapine. Which of the following is not true? Which of the following is not true? If a drug is administered rectally, it follows first order kinetics. If a drug is administered IM, that is intramuscular, it follows zero order kinetic. If a drug is administered IV, it follows first order kinetic. Bioavailability is usually lower after oral administration. Bioavailability is usually lower after oral administration than IV administration. Option D. Cytochrome P450 inducers are, which here the option is phenobarbital and DDT. These are the inducers. Cimetidine, ketoconazole, theophylline, what are these? These are the inhibitors, they are not inducers. Next, 24th one. Drug distribution is influenced by, see, plasma protein binding. Yes, drug get influenced by this, means distribution get influenced. Lipid solubility, yes, it is also right option. Degree of blood flow, it is also right. Age, yes, it is also right. Option A, B, C, it will give majority of the grades, but option D, age, is little bit slow, but A, B, C is the right answer. True statement about route of drug administration is 80% bioavailability by IV injection. No. 80%, 100% bioavailability. Intramuscular administration needs sterile technique. Yes, it is the right option. Right one. That is option B. ID, intradermal injection produces local tissue necrosis and irritation. No, it's wrong. Inhalation produces delayed systemic bioavailability. No, it is also wrong. It won't delay the systemic bioavailability. Volume of distribution drugs is altered in, come for the 26th. Volume of distribution of drugs is altered in which patients? Is altered in, yes, obviously obesity patients, pregnancy patient, old age and neonate. Actually in pregnancy and neonate patients, the distribution of drug is very fast because of increase in the blood pressure, but in obese patient and in old age patient there is a volume of distribution decreases because old age means there is some sort of less blood flow, means bradycardia they are suffering, and in the obese patient due to their bulky body there is a less flow of blood, means distribution of drug is less. Which of the following are prodrugs? Yes, 27. See, mercaptopurine, yes, dipivifrin, enalapril, 3 are right, A, B, C. 28. High first pass metabolism is seen in which? Yes, lignocaine, propranolol, salbutamol, A, B, C, 3 are right. In hepatic metabolism, phase 2 reactions are phase 2 methylation and sulfonation, methylation and glucuronidation, B, C and D. 30. Our last question. High hepatic excretion ratio is seen in among the following. High hepatic excretion ratio, that is option D and option E, imipramine and theophylline, means the drug get fast metabolized, means there is no remaining of blood in the liver. Okay, all the blood metabolite they get excreted in the form of urine or in the form of they are collected in the bile, they are excreted in the form of bile, majority in the form of urine from the kidneys. It is imipramine and theophylline. High hepatic excretion ratio. Yes, these are the 30 important questions. Follow these questions. Tomorrow let's discuss about some more new questions. Thank you.